You may receive a pre-appointment telephone call. This is just to ensure that we have a good understanding of what medication you're on and what your past medical history is. This is just to ensure that none of the drugs you're on are contraindicated with the chemotherapy, and if there's any further tests we need to do to make sure that we give you our treatment safely. To give chemotherapy safely, we have to ensure that you have good venous access. And all of that means is that we have to ensure that you've got good veins. If you haven't, we would have to then consider looking at other ways to give you the chemotherapy safely, for instance, a portacath. This would be discussed with you when you attend for your pre-assessment. Also, some regimes require for you to have a permanent device, and this is inserted in the chest. Now, this will be discussed with your oncologist at your appointment, and then when you attend for your pre-assessment, we will go through this with you at length. So when you attend for your pre-assessment, we will do routine observations, for instance, like your blood pressure, make sure everything's okay. We'll do some specific bloods that we need to make sure that everything is safe for us to give your chemo, and we'll also do an ECG.
Yes, we hope to have an appointment for you within 2 weeks of referral. Sometimes it can be a little bit longer, sometimes a little bit shorter. It is possible to bring appointments forward if you have some flexibility to travel to some of our other units across the Trust.
Your first appointment on the oncology unit will be for a pre-assessment, and this takes approximately 45 minutes to an hour.
We do recommend that you look at stopping smoking when you're undergoing SAC treatment, and there is support and help available, such as the smoking cessation service. We do recommend that you don't drink more than your weekly allocated units of alcohol whilst undergoing SAC treatment, and this is because of the way alcohol is metabolised by your liver and your kidneys, and this will be discussed with you at your pre-assessment appointment. We do recommend that you maintain a healthy diet whilst you're on treatment. There are things that you can't eat whilst you're on treatment. You'll be told these at pre-assessment. We will also be able to refer you on to other services such as a dietitian if we think you need that.
Well, when you come for your appointment, it's really useful to wear something comfy and some comfy shoes. Bring something to entertain you, books, puzzle books, magazines. Bring a mobile device and make sure it's fully charged. Well, bring yourself, bring a family member, someone who can support you. It's also useful to have something you can make a note of the things that we discuss to take away with you, because it's sometimes hard to remember. We do provide a lot of information. When you attend, it's nice if you can bring a family member or a friend with you, but we do ask you to keep that to one person. We also suggest that you check that they're well before they attend with you, no signs of infection.
The transport options available to attend appointments are patients can bring their own cars. We have dedicated bays across all the sites for oncology patients. We do recommend that patients always get dropped off for their first treatment, just to ensure there's no issues. There is also the option of the patient transport service, which can be arranged via the GP. And there are local bus and taxi services that are available at patients' own expense. Patients are entitled to free parking whenever they attend for appointments at oncology. You'll be given a permit to use in your car. That can also be used in friends and family's cars too.
When you come for your appointment, we offer you a warm drink or cold drinks. There's biscuits as well. We have a light lunch at midday, and then any visitors that come with you, we do recommend that they bring their own snacks because we're unable to provide food for them at the same time.
Depending on your treatment regime, you will see your oncologist. We will explain this at pre-assessment how often this will be. Depending on your treatment regime, you may require a CT or an MRI scan, and we will explain this at pre-assessment. Certain treatment regimes require specialist blood tests and sometimes certain scans, such as a scan of your heart. At pre-assessment, we will explain this to you.
There are many different support services available during and after treatment. These are both local and national services. We do provide lots of information on the unit via leaflets. However, the internet has an abundance of information and we will happily signpost patients to the relevant services. Needle phobia is really common amongst patients. We do have a lot of different distraction techniques that we do implement on the unit. However, if you feel the need, we will always refer you to a specialist service to overcome that fear.
Yes, you can continue working while you're receiving chemotherapy. You need to discuss this with your consultant and your nursing team. While having treatment, we'd like you to keep as active as possible. You can do any activities you wish within reason, as long as you feel fit and well and you don't tire too easily. Not all treatments cause hair loss. If the treatment that you were receiving caused hair loss, we could refer you to the wig specialists, and there was also scalp cooler, which we use on the unit for certain treatments as well. Again, to be discussed with the oncology team or the consultant.
When you attend for your chemotherapy appointment, obviously everybody's regime is different. You could be with us for 30 minutes, you could be with us all day. Obviously, when you attend, we will discuss this at length. The main side effects of the treatment are chemotherapy-induced nausea and vomiting, fatigue, constipation, diarrhea, sore mouth are some of the most common ones. Everybody's side effects are unique to them and everybody will feel different to their chemotherapy. We have to work as a team, we have to be honest with each other, and you have to let us know if you are struggling, because there is always something we can do to make things better.
If you're unwell whilst undergoing SAC treatment, you will be given emergency helpline numbers and you will be told how to use these and when to use these. And you will also be given the opening times of these numbers. During our opening times, you will be directed to ring the ward where you're having your treatment. When you ring this ward, the nurse in charge or coordinating the ward will then speak to you and discuss your side effects. Depending on your side effects and their severity, you will then be given a plan of action of how to deal with these. These may be self-help measures at home, they may be speaking to your own GP, they may be speaking to a pharmacist, they may be coming into your local day unit to be reviewed, or you may be directed to attend the local ED department at NSEC. So if you're unwell and you're asked to attend hospital, you would need to bring an overnight bag with you containing anything you would need for staying in hospital overnight and maybe for a few days, and also bring a list of medications with you and also those medications. Yes, there is support available for your emotional well-being. It is very hard emotionally when you're going through SAC treatment. There is places we can refer you on to. There is lots of peer support. There is also online peer support, which you can access in your own time in the comfort of your own home. And we can point you in the direction of these services. Once your treatment ends, you'll be followed up by your oncologist and your specialist nurses. They will then inform you of your next steps.